Hello there. Welcome to another episode of Rare Diseases, a podcast run by Rare Disease Review Western, a student-run not-for-profit organization that aims to translate complex rare disease research into easy-to-digest articles and support and advocate for rare disease patients and caregivers. Today, we welcome Daniel Kinchlea, a young rare disease patient from London, Ontario. Daniel will be speaking to us today about his journey and experiences in the rare disease community. Daniel, it is a pleasure to have you on the podcast today.
Thanks for having me.
And thank you so much for taking the time to come out for an interview.
Yeah.
Awesome. So I guess, are you ready to start off with the first question?
Yep.
Awesome. So yeah, thank you so much again for joining us today and essentially, inaugurating the restart of the Rare Diseases podcast. I guess my first question is, can you start by telling us a bit about yourself and what you're up to for this Rare Disease Day?
Hi, I'm Daniel Kinchlea and I'm 10 years old, and I'm going to be spreading awareness at my school. We'll have a party and my classmates will learn more about me living with rare disease. I have a rare autoinflammatory condition, and my rare disease journey was especially challenging at the beginning before I had access to treatment. I lived with multiple painful symptoms and a life-threatening blood disorder called MAS or macrophage activation syndrome, and also developed lung disease later on. My parents faced many challenges finding doctors that could help me, given I am a very rare patient. Thankfully, they did. Some of my doctors are also actually professors here at Western. My health is well managed now, but I still have flares at times. Living with rare disease has been challenging, but I've been able to advocate and learn a lot about medicine, even at a young age. And I'm living relatively normal now.
Right, that's really exciting to hear. And, party sounds like a lot of fun for Rare Disease Day. And, I can tell that you've been really involved with, sharing your story and telling about your experiences. Can you tell us a bit about your experience with the rare disease and what that's looked like for you?
Living with a rare disease is tricky. It often feels very isolating at times. It's very different, as you could probably say. But there are times, if you find the right medication and join groups with this, you can feel less alone, know a bit more about it, and maybe even someday contribute to the cure or diagnosis of new diseases.
Oh, thank you so much for sharing that, Daniel. Yeah, it can be hard to figure out, a rare disease diagnosis and to even start off with that experience. But it seems like there's been a lot of support in, your journey so far. And it's also, again, also really inspiring to know that there are professors, there's doctors that work at Western and in our London community who are so involved with rare diseases and are, so willing to help out with your case. So that's incredible to hear.
Yeah. Thank you so much for sharing that. I think that's something probably a lot of people with rare diseases can also relate to. And I think those are some really great tips you've given, like with support groups, finding a community, finding a support system, can be really good. And, it sounds like you have a great one. So I'm glad that you've been having that support. And I know you also mentioned that, eventually maybe you could get to the point of actually contributing to learning more about the disease or finding a cure. So that definitely sounds like something you've been interested in. And we have also heard that you are super interested in the sciences. And you recently did a science fair project about macrophages. And we were just wondering if you would want to give a quick lesson on immunology and about what your science fair project was about for our audience, because we'd love to hear more.
We have two main immune systems that you've probably heard about, the innate and adaptive immune systems. The first cell I'm going to be explaining is the macrophage, which belongs to the innate immune system, and its essential job is to eat bad particles. There is a second cell, which is also the first line of defense, called a neutrophil. It can create wide nets that are sort of like poison traps to kill bacteria. It's very good at its job, which is destroying. And now we move on to adaptive. though we start with the innate. Dendritic cells, an innate immune cell that travel through the blood to make it to lymph nodes. Kind of hypercities for adaptive action. They send messages to the adaptive immune system. Two cells in the adaptive immune system are the T and B cells. T cells come in two main forms, which are activated by MHC class 1 and 2. I have no idea what MHC stands for, but I will just tell you that it's a receptor on cells. After they're activated, MHC class 2 cells are called helper T cells, which the name is very descriptive, as they will go and help the innate immune system fight off an infection. The second one, MHC class 1, is ultimately more dangerous. Its main job is to dissolve infected cells. This is the basis, the first few lines of the defense in our immune system, though it gets much more complicated later on.
Yeah, and to be fair, I think you gave a better explanation than I ever could about the immune system, even if you asked me today. So I think that was really good.
Ah, that was awesome. Thank you so much for sharing that. Both Ovia and I were actually in the same program, and we both did our major in university in microbiology and immunology. So it's always really exciting to hear about, people who are into immunology. And it's exciting to hear that, people as young as you, Daniel, are interested in immunology. So that's awesome.
Thank you.
So I guess stemming from that, I mean, you have a really, great drive and passion for the sciences even now. And we were wondering, what are your future aspirations or like goals moving forward in life?
Okay, publish multiple series of books, starting with the second book to the first Fire Dragon. My next is to become a research immunologist. I want to contribute to finding a cure for autoinflammatory diseases, or at least more effective way of treating them. And I want my own autoinflammatory research lab.
That sounds really exciting. And I think they're amazing aspirations, and I'm sure you're going to accomplish each and every one of them. And I know you mentioned your book when you were talking about it, First Fire Dragon. So congratulations on that, on your recently published book. For our audience who might not know about it, can you tell us a little bit about the book and maybe what motivated you to write it?
What motivated me was my experience living with a rare condition to read, especially fantasy books. So the first Fire Dragon is a book about my journey, but from a fantasy perspective. It is a children's book written about a little dragon before the world knew that dragons could breathe fire. He doesn't understand what's happening to his body as it changes and goes on a journey to find help, though there are actually non-fire breathing dragons in the world.
I mean, I had a chance to look into the first Fire Dragon a little bit as well before the interview and just looking at the synopsis, but it it's such an inspiring story. It filled me with a lot of hope, the way that you approached it when writing it and like the idea behind it.
So I can actually recount most of the lines from memory. So if we want to move on to the reading, we can.
Yeah,
Actually, what we were going to ask you next, so that works great. So if you would like to share a couple of your favorite lines from the book, we would be honored.
One of my favorites, I'm gonna go to the very, very first page and read the dedication. I want to give special recognition to my mom, Chris Kinchlea, Dr. Roberta Berard, who is also an associate professor at Western University, and Dr. Rayful Schneider. You've probably heard of him, though if you haven't, he works at Sick Kids as one of the top doctors for rheumatology in Canada, if not the world. So, though the characters in my book are fictional, some are based on real individuals in my life, specifically the amazing doctors who helped me in this life or death situation. Dedication to my care has helped me become the best version of myself. I really, really like the line, I will help you. It's the little dragon talking to the physicians. And yeah, it explains a lot about what I do as an advocate. Really, really, really liked the description of the physicians. A tall man with dark hair, kind eyes, and a flowing robe, and a book in his hand. The kind eyes part is a very good description of Dr. Rafel Schneider, who is one of the kindest doctors I've met. And this is it's not a nice line, but it's a pretty funny one. The troll danced around the dragon, eyeing him up and down, and started singing. Dragons don't have fire, dragons don't burn. You say that your body hurts, but dragons don't burn. Yeah, it's a pretty funny song. There's another line in the book that probably is my favorite of all. We don't know how long it will work, but we promise to be your friends and keep searching our books and learning how we can help you. Use your fire to burn bright for everyone.
I I really like that line as well. I think it, really captures a lot of the hope. And no, those are some really great lines that you selected. And I think it also kind of shows the people you've had supporting you. I'm just curious, were there any other lines you wanted to share with us?
Those were the main ones I want to share. It's actually available on Amazon.
This would also encourage our audience to actually go and, buy the book, and so we can all read it ourselves. I think I'm definitely going to be doing that after this episode. So you did mention wanting to write future books, and something just I'm curious about is if you have an idea already going on, or is that something far into the future that you're going to be thinking about later?
I do have plans for a novel on immunology that I'm gonna be writing, but I'm also hoping to write a second book. Here's a little spoiler. The Waterstone breaks. The only way to heal him is great fairy dust. It's called The First Great Fairy, an Autoinflammatory Adventure. And the Great Fairy is probably based off my sister, who's kept me bright and happy through this very, very long and exhausting journey.
That is really sweet. And thank you so much for sharing that little tidbit. I know, glad we could, hear it first to the audience. Yes, you heard it first. There is going to be more novels, and we'll all keep an eye out on that. And yeah, no, we're really excited to read that and for everything that you have to come in the future as well. All right, so that was, again, thank you so much for sharing your journey with us, some of your book, and that amazing immunology lessons for our audience. I think everyone now is going to have a great understanding of the immune system, all thanks to you. But before we wrap up, I'm just curious if you had any other comments you wanted to share, or if Omar had any other questions.
There is one thing. Hey, Mom, could you join me for this? So, me and Mom have decided that I'm gonna start doing my shots on my own, and I was hoping that we could actually record a few and possibly publish them on YouTube or Instagram, sort of tutorials on how to do your shots on your own. What do you think of this idea?
Yeah, so Daniel has to take a weekly injection, and that's, the treatment that he gets for his rare disease. It's been a long journey of getting injections when he was first such a little person, right? His treatments were quite painful, if you get them an injection, and then they also had to be kept in the fridge to be kept cold in order to preserve the medication that he was using. So, when he first kind of started out on his journey, like getting needles was a big obstacle that he had to overcome. And so now we're celebrating him because at 10 he does his injections all on his own. And I think, maybe, yeah, in the future that's something you and I can work on, buddy, because that would be really cool to be able to show other kids what they're capable of, and that, giving yourself an injection it's not an easy feat. So
Yeah.
Yeah, no, I agree. Like, I think that is, definitely very impressive. Injections are not easy, and I'm sure, like, even now, probably still not an easy thing. So I think being able to share that again, I think it would be nice to view that as a celebration of how far you've come. And I'm sure, like, everyone would love to join in on that celebration as well.
Yeah, and it also is it's important to spread the knowledge as well. Like if, you've made it this far in your journey and like your way around it, taking your shots yourself, right? Other people that are, just starting out on their journey or that are, still on the path, right? Definitely, I think appreciate seeing you doing that. And it's really good to have a role model in those sorts of areas where perhaps there might not be another person otherwise, right? So I think it's really awesome that, you want to take the initiative and do that. That's amazing.
And I think that was very well put, what Omar said too, because I think, again, you did start on your journey very young, and I know you did mention it was scary and isolating at times, but I think, a role model is what you've become for a lot of other kids and just a lot of other people with rare diseases. So, yes, that is very inspiring, and I'm glad you were able to share that journey with us today. And, we had an amazingly incredible and insightful discussion with you today, Daniel. So thank you so much for that. And again, thank you so much for your time today, taking the time to do this interview and for all your fantastic ideas.
Thank you, and I'm glad you had me. I'm very happy that my story's being shared even broader now.
All right, perfect. So once again, thank you so much for your time and for all your fantastic ideas. And again, to the audience, there you have it, our first episode of the reboot of the Rare Diseases podcast. And we hope you enjoyed listening to Daniel and his experiences as much as we did. Yeah, stay tuned for our next episode by subscribing to the Rare Diseases podcast on the YouTube channel or following Rare Diseases podcast on Spotify. And you can also check out the description for the link to the Rare Disease Review Medical Journal and our social media pages on our Instagram. So this is Rare Disease Review Western and Daniel signing off.